Welcome everyone. To the ones arriving, there are seats here in the front on both sides. Dear guests, esteemed public health experts, a warm welcome to Helsinki. And a warm welcome to everyone as well who's watching this via the live stream elsewhere here at the Finlandia Hall. My name is Partanen. I have the pleasure of hosting this opening ceremony for the 18th European Public Health Conference. As we saw in the video, we are convening here in tough times for the world, tough times for many working in public health. But as we saw in the video as well, every challenge is a reason to act, and we are here for these few days to figure out together how to continue to invest in sustainable health and well-being despite the challenges, or because of the challenges. The local organizing partners of this conference are the Finnish Institute for Health and Welfare and the Society for Social Medicine of Finland. It is my pleasure to invite to the stage the representatives of these organizations. Research Professor Ilmo Keskimäki from the Finnish Institute for Health and Welfare, and Professor Tomi Mäkiopas, Chair of the Finnish Society for Social Medicine. Ilmo also serves as the chair of this conference, and I will now hand over to Ilmo.
Thank you. Dear friends, a year ago I sent you from Lisbon heading north. Since then we've sailed along European western coastline from Atlantic to the Baltic Sea and landed in Helsinki, the cool and sustainable capital of Finland. The country ranked the happiest in the world 8 years in a row, according to the World Happiness Report. Finland's success is due, at least in part, to timely investments in people's health and well-being. These efforts have helped building a functioning society that citizens can trust. Creating a well-functioning society, one that is inclusive and built on trust, is not a quick process. But dismantling such a society can happen all too easily. We are seeing examples of that today in Finland, across Europe, and around the world. The world has changed fundamentally in recent years. Without going into any details, it is fair to say that well-being and health of people and our environment are more threatened now than ever in our lifetime. The video we just watched showed a few examples of these threats. Finland is often said to be larger than its size. On a global scale, we are a small and sparsely populated country in the far north. Yet sometimes our influence exceeds what our size might suggest. Europe, too, can be larger than its size. Europe has opportunity, perhaps even the responsibility, to lead globally in advancing the well-being economy, the well-being of the people. Instead of focusing solely on economic growth, European countries should, in line with the theme of this conference, invest in health and well-being of their populations. After all, healthy and capable people are the foundation of sustainable economy. To quote Kate Raworth, we need an economy that makes us thrive, whether or not it grows. By investing in population health and well-being, we can support social, economic and environmental sustainability and build a better future. And it is precisely a better future we must strive for. Dear friends, as the video reminded us, a healthier future needs public health at its heart. There are 3,000 public health professionals gathered here today. Together, we have the strength to make a difference. We need on continuing gathering evidence and communicating it broadly so that sound research guides decision making. Because investing in health benefits society and promotes a sustainable economy. Health is the foundation of everything. I will end my remarks with that thought and warmly welcome you to Helsinki and to the 18th European Public Health Conference. Welcome, tervetuloa, välkommen, pures pohattiin.
Thank you, Ilmo. We will open the conference in a way that has already become a sort of a tradition. We will listen to the European anthem, Ode to Joy. It will be performed using a traditional Finnish instrument, kantele, but perhaps in not such a traditional way by the Finnish artist Iida-Elina. Iida-Elina is an internationally acclaimed Finnish singer-songwriter, and you could call her a pop kantele queen. And she's a trailblazer of Finland's national instrument, kantele, a type of zither. Welcome, Iida-Elina. Thank you, Ida-Elina, and we're lucky, and we will get to hear another song from her later. Now we'll move on to our panel discussion of this opening ceremony. But first, we'd like to hear from you. We have a question for you on Mentimeter, and I think we'll have the instructions here in a moment. What do you see as the biggest challenges for European public health going forward for the next 5 or so years? I see that you all already know the drill, but you can either scan the QR code or go to menti.com and give us an answer in one word. You can do multiple answers. And later we will have a word cloud here on stage, and hopefully with our panelists we can also reflect on what you all have said and how they feel about it. Do they agree? But now it is my honor to invite to the stage our distinguished panelists. Please welcome to the stage Dr. Hans Kluge, Regional Director, World Health Organization, Europe. Sandra Gallina, Director General, DG Santé, or Directorate General for Health and Food Safety at the European Commission. And Veli-Mikko Niemi, Permanent Secretary from the Ministry of Social Affairs and Health in Finland. I will ask Sandra and Veli-Mikko to sit here in the middle, yes, either seat. And we will start the panel with Dr. Hans Kluge, and he will give us key points of the new program for work at the World Health Organization. Go ahead, Dr. Kluge.
Huomenta Helsinki, huomenta kaikki. On ilo olla täällä. Good morning Helsinki, good morning everyone. It's such a pleasure to be with you here. And you know that I'm a born optimist, always want to start with the positive news. The recently published core health indicators from our office show that we recovered in life expectancy since the COVID-19 and are on the rise again. Having said that, I also know from my work in the European region and with member states all over the world, from Ukraine to the Sahel, from Central Asia to Southeast Asia, I see one truth, that we are no longer moving from one crisis to the other. Basically, we are navigating permanent disruption, which means that our public health response and the multilateral response has to evolve as fast. And that's exactly the reason why we decided to develop the new 5-year pan-European health strategy, the European Programme of Work, around what we call mega trends, which are shaping society. And we have a slide summarizing those here. Number 1, health security. How can a country be safe without the essential stock of vaccines and medicines? Number 2, NCDs and mental health. And here I really want to thank the Director General, my good friend Sandra Gallina, for the support and the vision for the first time to have a pan-European survey on the mental health of the workforce, which was very, very sobering. Number 3, healthy aging. How many of us have parents, grandparents, who have no place in the elderly homes or feel belittled? And congratulations to the Permanent Secretary, Niemi, with who we discussed yesterday, Finland being a front runner on linking health and social care services. The 4th megatrend, climate action. Can you imagine, for the first time in history, Iceland has now mosquitoes after a very, very hot summer, unimaginable before. And in the middle, we need the health systems of the future, not at least to keep pace with what I call the 4th industrial revolution with the artificial intelligence. The EPW2 also has 2 special initiatives. Number 1, something which terrifies me, the violence against women and girls in every single country, of the 53 and femicide increasing, completely unacceptable. And number 2, primary healthcare. We calculated that all the primary healthcare workers in our region are delivering 7 billion primary healthcare visits a year. Can you imagine? 7 billion opportunities to prevent disease, promote and protect health. 7 billion public health opportunities right in front of us. And we will need the action here. Because I remember 10 years ago when we were standing in Milano under the patronage of Professor Walter Riccardi, that my other senior advisor, Professor Martin McKee, was speaking about the public health threats being at the scale and magnitude of the 4 horsemen of the apocalypse. War, death, plague, famine, and look where we are. Actually, many people told how visionary Martin could foresee this. I myself, I was not surprised. Because each time I go to Martin with a problem, he says, Hans, I thought about it already 6 months ago. And I published already at least 10 articles about this. Thank you so much, Martin, for all your great advice. So, my friends, the question I'm getting then is, where is public health in all of this? We have to look at that one through a very visionary concept, again championed by the host country, which is the economy of well-being. Finland was the champ of health in all policies, moving now to the economy of well-being, which is pure public health, which is everywhere, putting the people in the center, decreasing equity, involving all people in society and all sectors. And a big advantage is when we speak about health, when I speak about health to the government, they say, yes, but you have a Minister of Health. If you speak about well-being, it has co-ownership by literally every sector. So congratulations, Permanent Secretary, really on that one. At the same time, I do realize that if something is everyone's responsibility, soon it's nobody's accountability. So I took this into account. We have Emilia Aragon in our office, who is the focal point on public health, the go-to, under the guidance of Natasha Ozopardi-Muscat. I mean, how more committed do you want me to be to public health? To have a past president of UFA in the team, right? So in that sense, I want to reassure all of you that the public health, the economy of well-being is there. Finally, witnessing the solidarity and the science in this room and all your colleagues outside, I have no doubt that we will be able to address the 4 horsemen heads-on with courage and care, as Alexis Kivi, regarded as the father of Finnish literature, reminds. Luja tahto vie läpi harman kiven. A strong will takes one even through a grey rock. Thank you.
I will commend Dr. Kluge on his understanding of Finnish and Finnish culture. Very much appreciated. Let's bring in our panelists. Sandra, Gallina, what do you think are the biggest challenges for Europe right now? And how are you planning to solve them?
Do I need a microphone?
Yes,
Otherwise
please.
It will be challenging.
They should be on, right?
Yeah,
I think.
They should be on. So,
yes.
Well, first of all, thank you for being here amongst many friends, in particular 2 real friends that have gone through thick and thin in these years, that have been quite agitated for health. It's also a privilege to be in Finland for one reason. If you deal with health, you know that Finland is a pole of innovation. So here you have innovation, but you have also inclusion, which is not sometimes something to be taken for granted. So it's a country of innovation and inclusion. And also, I would say, a country which is thinking of health and public health in particular, not as an afterthought, but as Hans was trying to transmit, your country thinks of public health as a real means to democratic life, which I think it's a fundamental trait of the Finnish colleagues that I meet very often in my job. If I were to pick a few, there are many challenges, but I also think that we need to be really aware that Europe is big, Europe is strong, and Europe has many assets that we need to tap into. So my real message, if there is one that needs to stay beyond this room, is that we will overcome. There are difficulties, but we always united overcome them. So the real challenge is to stay united, if you want my point of view. We need to stay united. And if we go more into the topics of your conference, there were many, and my people have made me a big selection here. My first thing is that after COVID, we are a bit catching our breath, meaning that we had a big spurt, everybody was into health, we felt that the ground was being populated with a lot of good interest, some not too good interest also, but lots of popularity. But at the end of the day, we are running out of breath because, and we were discussing this just now, we need to speak the language of numbers more. We need to speak the language of investment, of thinking of health, and in particular public health, as the most important bet for us to have resilient societies. So it may be a bit, I would say, hackneyed word to say health is not a cost but an investment, but it's the reality. You need to have resilient societies, you need to have people that are ready for many challenges, including military service, so you need to have healthy people if they have to join a military service. If they join with a bit of a problem of obesity, even if they are young, they will not be good. So I'm sorry to put it so crudely, but you are all fantastic experts, and this is important that you convey to us what is needed for a resilient society, what is needed, so that we can then go around with our pot and say, we need to support this. I think that in all the words that I was seeing behind me, I was very struck by the fact that prevention was very small, because it's my most dearest part. I also think that there are other words that I have put and I have clicked, but I tried to push a bit prevention. Prevention is very important, and I would like to thank all of you for drawing the attention of the politicians on that topic. A few elements that I need to mention to you, because we are not simple idle bystanders. As Europe, we're trying to give our contribution. And I think that the first word that I need to spend, because yesterday it was really a big anniversary for me. It was the anniversary of the big health union package. I still remember in the middle of the storm in 2020, on the 11th of November, which for those who know Germany, it's a very specific date for them. We had German presidency, the German minister convened a big formal EBSCO, and we launched, I would say, the big revision of the regulation of the cross-border health threats. Serious cross-border health threats, I could add, but we have a certain way of dealing with this. So that big package, Anu, what we were trying to do there is to revisit all our agencies. This was the first point, because the agencies, when we were struck by COVID, we could see that they were not up to what they needed to do, but we particularly decided to improve the way we are prepared. And the first, I would say, element that we looked at was trying to give ourselves the power as Europe to declare a pandemic. Because I must say that we had a long trek through the desert in waiting for a declaration of pandemic, and this is in the hands of us Europeans. It's very important that you know that today we have this possibility. We also decided that we need to have a union plan, and not just to have a sum of national plans of preparedness. I want to make a very clear distinction here. Every member state, thanks to ECDC and also to us, goes through a process of assessing its preparedness. These visits are quite useful because it also, when you have discussions of money for the semester, you can say as a country, well, listen, we told you that we have this need for capacity. And capacity is definitely not only the hardware, it's also the software that goes into education. And when I go into prevention, I must say that education does a lot to avoid that you become, I would say, a person that has a perfect shape, but you destroy yourself, you need to have education. There are many things that are bad, including tobacco, for which we hope to come out with a revision of the legislation next year. You know, these are things that you learn in education. So I go back to the preparedness. I would invite you all to the workshop that my people are organizing here, because we will have a union plan. And the union plan is very important because at moments of emergency, the first thing is that everybody's running around like a headless chicken. I experienced that. I have seen people not responding to a role. And if you push it further, and I dare do this in this very country, it's quite good that member states start seeing, I would say, preparedness as a whole of society business and going in as far as to have every citizen well prepared for the emergency. This is the case of Finland. We know that Finland is, I would say, at the forefront of a type of culture with the civilians that enables them to be, I would say, a center of almost services at a time of emergency. Each of you in Finland knows what to do if an emergency happens. This is not the case with all the member states. And the member states in the Health Security Committee are very interested in this experience, the experience of Sweden also. It may be a trait of the Nordics, but you know, preparedness starts at home. You know what to do at home. I must say that it's very short the time, and I don't want to bore you all, but I need to say something also about digital and AI, because this is a big challenge. AI in some countries, the digitalization has taken a very democratic turn, and it's a force for good that is accepted by societies. In general, we are trying to promote trust. But let me say to you, for me personally, what is critical in AI models is that we have something that is, of course, I would say ethical, that's the first thing, transparent, but especially explainable. Explainable. If you can explain why you need to use the data and to use an AI model on the data, I think that people will trust you. And the big word here is trust. Without trust, we will have nothing. I already mentioned to you that prevention is very big for me. We can spend hours on that. Of all the topics my people have been collecting for me, one word for the workforce. Yes, the results on the mental health of the health workforce were quite sobering. There is a real problem. Let me say there is a problem in Europe for mental health. 1 in 6 has a problem, which is not small. And my issue is also that we are having a problem with younger generations. And here we are tasked with an inquiry that we will launch. Basically, I will be making this a bit very mundane in my words, because I'm not as good as Hans. Hans is the good part, the top part. Me have doing the chores. But the chores say that we need to do an inquiry on what is the effect on the mental health of young people when they stay so much in front of screens. This we are taking up from the very good event that the Polish presidency did at the informal EBSCO, where we could see from a group of adolescents that were invited to present to the ministers how they see the world with the exposures they get. And it's terrific, because they see, and terrific in a bad sense, they see the world, a world of fear, a world of threats, a world of... It was quite impressive. For me, that experience stays in my mind. I will stop here because there are many more challenges, but I would say being prepared, using AI for good, I stress, and then, you know, caring about our workforce are for me the 3 big challenges that I see for Europe. But Europe is a strong system of public health most of the time, and we should preserve it, speaking the language of numbers. Thank you.
Thank you. I saw Dr. Kluge making notes. I will let you comment in a moment, but Veli-Mikko, Niemi, you represent Finland, the national government, member of the European Union. So what are you thinking of when you're thinking of public health in Finland, and what did Sandra Gallina's notes make you think?
Thank you, and good morning or good day for everyone. It's a great pleasure to see so many people here in Finlandia Hall here in Helsinki. You are very welcome to Finland, and I hope you have some free time also to have a walk here around, for example, the Tönelahti Bay, which is very close to here. But on this very important topic, we are gathered here during these days on public health. I totally agree on the megatrends and the lines that Dr. Kluge and GD Gallina was expressing. Maybe my biggest worry also in terms of public health is unity. That how we are going to develop our societies and our continent in a consistent way. We have now very different parts, and our decision makers, politicians, they need to sometimes to choose, and very often to choose, whether it's defense, it's security, or is it economic growth. And that is hard time for people who are saying that, look, public health is the basis for all societies and all the work which we can and we must do also in terms of security and economic growth and our investments. And that is something we need to be much stronger to speak, and one element and one instrument to do that is the economy of well-being or well-being economic type of thinking, where we, to put it very simple, we try to say that as it often is said, for example, in media, that how expensive it's our elderly care and how expensive are our hospitals, how expensive are our prevention programs, and that they are only eating the cake which the other society parts are producing. But we have to convince that actually we are strongly making the cake. We are making people living longer. We are making people living better lives, that they can stay at working life longer and be productive, but also that they can be, let's say, decent citizens in the society. They can take their responsibilities. Like Sandra mentioned, the military service is quite a good example, and in a way a traditional example. I would like just to finish by reminding that we are just now sitting on the same podium where about 50 years ago the heads of states of 35 countries were signing the so-called Helsinki Agreement in the European Conference on Security and Cooperation. And just that the main message from that agreement was clearly united. We got united Europe. There are now many challenges for unity in Europe, but we have also our strong organizations like WHO and European Union. And a small country, as it was said, at least by population, as Finland, we trust on, and our strategy is to get good friends and work together with them in a unified way. Thank you.
Could we get our word cloud up, and we could take a little bit of a look? So we have, being Finns, we're always focused on the problems. So we asked the challenges, and perhaps when Sandra, you were talking about prevention, that could be a solution. But so we have the big ones: climate change, rise of the far right, polarization, poverty. What stands out to you when you look at this? Is there something that makes you think? Dr. Kluge.
Thank you. So, no surprise, the misinformation, and I think there I would like to appeal to the public health community, because there is where we need you a lot. We have the evidence. I call it the music, but we don't have the loudspeakers in WHO. We need loudspeakers, as Director General was telling, Sandra, you were telling, right, to speak to the numbers, but in a compelling way. So that you help really to restore the loss of trust and the loss of influence in science. Also, if you see what's happening at the other side of the ocean. So this is really your and our joint responsibility. And of course, we know some things is working, for example, to empower local actors, the women groups, the youth. I'm a very strong believer of we established the Youth for Health initiative, and civil society. So that is really where I'm reaching out here. Thank you.
What about you, Sandra? What stands out to you?
You know, if I were to say, yeah, if I were to say, I'm very happy to see that climate is coming up as a big topic for us all. Hans mentioned the mosquitoes. Well, you know, I was hoping that at least in Iceland we would not get them, you know, but it's not a joke. And let me say, in 2020, I still remember I was fighting this very small war because with the European Environment Agency, we decided to set up an observatory for climate and health. I was almost derided when I said, but no, I said, you know, I think we need something because we need the data. And, you know, today is quite important, this observatory. I got lots of meetings, but the issue with climate and health is that also I would dare venture a thought that there is a bit of inequalities in the climate agenda, meaning that, let me be very frank, there is a big exposure in certain countries. The countries are already stretched out. So, of course, I'm worried about Iceland. I may be worried about Finland that is getting warmer, but I'm really very worried when I see parts of the southern part of Europe, or I would say wherever it happens to have all this disastrous not just fires, but floods and so on and so forth. Climate is changing, and we're not prepared for this. We are trying to be prepared. My friend Maciej, who is the Director General for ECHO, does fantastic work in trying to help when the floods strike or the fires strike. But it's before that we need to be different societies to tackle this. But it's a big challenge because you may say that outside Europe, and I know that there has been a lot of press that was criticizing Europe, even on the climate agenda. We're criticized on everything. But in reality, we had some difficulties in promoting this across the world. So let me say to you, it's a challenge for mankind. So well done to all those who spotted climate as a big issue.
And what about Veli-Mikko?
Yes, what was impressive for me was that your worries or your most important challenges, they are very political in a way. And they are those which in fact should be. And I would wonder if we had the same question for ordinary public here in, for example, in Helsinki, having people who don't follow that much international media. They are following some funny things. That would they have the same priorities? And I'm a bit afraid that they won't. And that's a very good sign that people who are working with public health, they have their ears open and eyes open to watch what is happening in the whole society, because there comes all the challenges we need to tackle.
Let's talk about solution. Could we do a round? Now is the tough part.
Gasping for breath.
Where each of you could say something that your organization or government is doing to solve one of these challenges, something concrete. Let's start with Dr. Kluge.
So I was showing that, I think that was a tour de force, that all the 53 member states approved I call it like the roadmap, the collective roadmap on the way forward, that at least around public health, we still can find consensus in this geopolitical divided world and unfortunately also region. So maybe to pick out one is that the North Star, I call it, the North Star of the European Programme of Work will be the science. I think there we have to, I see that it will be our region, Europe, the pan-European region, that has to be or remain the beacon of evidence-based medicine. Yeah. Because times will improve, but many people will suffer or die in between, particularly those at the margins of society. So again, that's why I really wanted to be present with all of you. First and foremost, to thank you from the bottom of my heart for the outstanding work you and all your colleagues are doing, and that we really count on you. As you were telling Sandra, it's easy to be criticized, but history will show, right, that we are at the right side. And we just have to now apply everything we were speaking about resilience the last years, to apply it to ourselves. And the solidarity, you know, is something very, very important. Do something good for the other one, and you will feel you will become much more bulletproof yourself.
Bravo. Thank you. Sandra.
Yes. Anno, you give me the possibility to almost make an appeal. I see a fantastic room teeming with experts, and what I really think you may say is, in terms of solutions, I can flood you with all the proposals that we have, but no. I think that a solution would be if you could help me in project the fact that public health is the basis of society. And you know, what I am afraid of these days is that public health becomes the collateral damage of other priorities. You know, my dear friend here says if you go out in the street, I'm sure that many people will be very worried about the war. And, you know, war is a different type of resilience, but, you know, it's in the gamut of resilience of societies. So let me say to you, we should not become the standard bearers of public health. We should not become the collateral damage of other priorities. So really, as Hans was saying, solidarity and all the principles that we have, we need to really project this as the basis of healthy societies, but healthy also ethically, morally, and politically. By the way, in these years, what I have witnessed is that health has become a very political topic. It's no longer an area where you only discuss, you know, the science-based thing. Well, it has become much more political. So please help us. You have the power with your writings, with your voices, to be able to convey the idea that public health is not for experts only. It's for societies. Unless there is public health, there's nothing. There's nothing, really. Thank you.
Veli-Mikko, please.
Well, first of all, I think that it's best to use the tools which we already have or we will have in our hands. And I think, of course, cooperation, as I already mentioned, and working horizontally in the whole of society manner is a good tool. We need to increase using it, and we need, of course, to convince the other sectors also that we need to cooperate. But here we have clear examples, unfortunate examples, because due to the war in Europe, we all to have be prepared more and more, and there, of course, health and prevention plays a very important role. That's one example, and we have other examples like One Health policies where we can work with close related sectors, but also the climate crisis is one reason why we need more and more of these kind of approaches. And then those tools which we already have, but we have to increase the use of them. And of course, it's many of them are digital ones, digitalization, and also the AI. We must use it as a good friend, not an alien which does what it wants, but we must use it also for the sake of public health, and we have the capacity to do that, and that is also one way to promote making the new cake with the capacity of public health.
Thank you. Thank you for our panelists, and you will be here, and we will continue the conversations over the next few days. Let's give thanks to our panelists here. Thank you. And for now, I will ask you to stay on stage, and we will invite Ida-Elina back. We will hear one more song from her, and it is her original composition called Under the Northern Skies. Please welcome back Ida Elina.
Dear ladies and gentlemen, I feel very honoured standing here today, welcoming you to Finland. And you know, I must ask that, how's Finland treating you so far? Yeah, we Finns know how you feel. Ladies and gentlemen, the instrument I'm playing today is called kantele. It's the national instrument of Finland, like you heard. And it's called kantele in Finnish, and in English it is called the kantele. So now you know. And I'm performing, the second song that I'm performing today is going to be film music. And I promise 99% of you have ever heard the song before, because like you heard, it's written by me. It is from the film Under the Northern Skies. The song is called Under the Northern Skies, and it says, "Here under the northern skies, I will wait for you, no matter how long it takes." And everything you're about to hear is happening live. So I'm creating some kantele loops first, and then singing some vocal loops as well to create a choir of me to be put in this song. So, ladies and gentlemen, welcome to Finland. This is Under the Northern Skies. Kaartu yllemme pohjoinen taivas. Allamme routainen maa. Miten suuri on aaltojen raivo, missä poikani kuljetkaan. If darkness should fill these eyes, if the years should dim my eyes, if the frozen haze will rise, here under the northern skies, I will wait, I will wait, I will wait for you. Here under the northern lights, I will wait, I will wait, I will wait for you. I will wait, I will wait, I will wait for you. Should the stars hide their faces, my
Thank you. This was absolutely beautiful, as the audience clearly thought so too. We would like to give you a little gift on behalf of the conference. Thank you so much for being here. And now we have Ilmo and Tomi back on stage here behind our panelists.
Thank you.
Welcome
for
back.
Great discussion. Thank you. Ida-Elina went away already, but thank you for music to her as well. So we really appreciated your discussion, and as a token of this appreciation, we want to give you this. Thank you.
Thank you, sir. Thank you. Beautiful.
Thank you very much.
Thank you.
And you as well.
And for me as well. Thank you.
Okay.
An applause to all this audience.
Yes, applause to our audience.
Thank you. Thank you.
We will now let our distinguished panelists leave, but if the audience can stay a little bit more, I think Ilmo and Tomi have some practical words for you. On my behalf, I thank you for the opportunity of being part of this opening ceremony, and I really wish you very fruitful next coming days to secure the public health of all of us. I am counting on you. Thank you.
Okay. Thanks. So, when we are here all together, we have some housekeeping rules for you, more or less. The entire Finlandia Hall and the adjacent Little Finlandia are reserved for the conference. Parallel sessions will be held both in the main building, in the Congress wing located at the southern end of the building, as well as in Little Finlandia, which is accessed from outside. Lunch and coffee will be served in all these locations. Please keep this in mind when heading to lunch after this session as well. And we have done our best to mark the routes clearly, but you can also ask our assistants for help. They are easy to spot in green shirts.
Yeah, and also the conference info desk, you probably noticed it's located downstairs near the entrance. But we want to remind you that it's open to public, so there may be a lot of people around who are not part of the conference. Also outside the hall, you can find over 20 exhibitioners from the exhibition area. And if there are anyone who is interested in knitting, there's a charity knitting activity you can find from the UFA booth.
And continue. In addition to the scientific program, there is a variety of side events, both in Finlandia Hall and around the city. Tonight, the city of Helsinki welcomes us with the reception at City Hall. Tomorrow, Thursday, we'll have the conference dinner and a concert by the Finnish Radio Symphony Orchestra. And on Thursday and Friday mornings, some of you will have an opportunity to start your day outdoors with a chance to try Finnish fitness activity, Nordic walking. Unfortunately, all these events required pre-registration, and at the moment, unfortunately, they are fully booked.
Yeah, but there are some that you don't need to pre-register. For example, you can join the groove dancing sessions. They are held during the lunch break in the meeting room 24. You can find it from the Congress wing. Of course, if the weather allows, there's also a Finnish game called Mölkky, throwing game you can borrow from the exhibition area outside. And then here at the Finlandia Hall, you can visit the exhibition area, find about Finnish identity, our legacy, and a lot of Finnish famous architects, Alvar, Aino, and Elisa Aalto. This building is also designed by Alvar Aalto, symbolize Finland. The exhibition is self-funded, but as conference participant, you can buy tickets to this special rate.
So in the building, we also have a first aid station, a nursing room, and a prayer room, should you need them. There are water stations throughout the venue, and you can also fill your bottles with tap water anywhere. In fact, according to United Nations World Water Development Report, Finland has the cleanest water in the world. So you are welcome to use it. And final reminder, we want everyone to feel safe at the conference, free from any form of discrimination or harassment, whether sexual, physical, or verbal. If you feel that these principles of safe space are not being upheld, please report it immediately to the conference information desk.
And finally,